Hello and welcome to our workshop today for our driving program and collaborating with the interdisciplinary team. Glad that you're all here. I'd like just to take a moment to introduce myself. My name is Amy Donabedian. I'm an occupational therapist and certified driving rehabilitation specialist. And today we're joined by so many members of this team, doctors, nurses, case managers, rec therapists, physical, occupational, and speech therapy. So thanks so much for coming today, and I hope that this will be a great collaboration that'll really help our patients for achieving their long-term goals. Our objectives for today are basically that I'd like you to be able to identify and describe two components of a comprehensive driving assessment following a medical event. I'd like you to be able to identify the roles of the occupational therapist as well as our other team members, and identify 3 screening domains that impact driver safety, as well as identifying a referral pathway for our patients with goals of returning to driving or alternate means of transportation. The OT generalist role here at our facility is really to identify patients that may need to go on for the specialized service of a full driving assessment. The OT generalist is usually doing the patient intake, gathering that information, identifying the goals, identifying any limitations visually, cognitively, physically. Maybe they're checking in with the other therapists, doctors, the nurses in the team, and gathering more information to find out if this patient really should move on for a full driving assessment. CDRS stands for Certified Driving Rehabilitation Specialist. This person basically chose to continue more education in the specialized field of driver rehabilitation and sat for a national exam, earning those credentials. Several programs throughout our network have CDRSs, but driving programs can exist just running from OT generalist perspective. They would not be able to write recommendations for adaptive equipment or provide any training. However, many programs do exist from an OT generalist perspective. The law in Massachusetts states that if a licensee has a medical condition which may affect their ability to drive, then they should disclose it. Many people do not do this. They usually go through a driving program or seek medical clearance rather than calling the registry and saying, yes, I've had a brain injury, a stroke, or whatever it may be. There are ways that the team can communicate with patients so that they are following the law of the licensing authority, as well as maintaining some privacy for themselves and going through the right channels to make sure that they are clearing themselves to return to the road, making sure that for themselves they're safe as well as for the community. The registry does have standards regarding several medical components. The first being vision. You need to have at least 20/40 vision for nighttime driving, daytime driving 20/50 to 20/70, as well as at least 120 degrees of horizontal peripheral vision. There is a cardiovascular and seizure standard, as well as respiratory and cardiovascular. And there is also our newest one as of 2011 as far as cognitive impairments. A driving evaluation may be appropriate because we need to determine if whatever medical event, traumatic or progressive or whatnot, has impaired their ability to drive. We need to determine when and if it has resolved. It will enable us to give appropriate recommendations to a patient. And it also gives more in-depth information to the physician who is ultimately clearing this patient to return to driving. Pre-driving assessment is 2 hours. We're looking at their vision, perception, cognition, physical abilities, brake reaction time, visual processing speed, basic understanding of rules of the road. Following the completion of the assessment, the patient is receiving recommendations right away. It may be that we're recommending they move right on to an on-road assessment with or without equipment. And the idea here is that we're trying to see, did we identify any clinical impairments? Will we see them on the road as well? Maybe we didn't see any impairments at all, and we want to make sure that in the dynamic environment of the vehicle that we're also seeing no impairment areas. We may send them back to an eye specialist to have that RMV vision screen form completed if we're wondering if they do have any visual field deficits, and we need to make sure that they have at least 120 degrees of horizontal peripheral vision. We may ask them to continue therapy and communicate with the team, saying we've identified some areas of weakness through lower extremity coordination and brake reaction time. Maybe it's a visual or a cognitive impairment. So we need, more therapy, more time before we want the on-road to be completed because we want this patient to be successful. We may also reach out to the physician for concerns on medications that have been identified. Maybe they're affecting the patient. And this could also be through nursing as well. And we may need to discuss with case management any resources for the patient in the meantime. We may suggest that they refrain from driving altogether and have a conversation regarding alternate means of transportation and other resources. Again, this is one that we really will be collaborating with the team for, and it's really important that everyone is knowing the needs of the patient and working towards making sure that they're able to still access the community and that they're getting the right supports. It can be a real identity loss for people, and we want to make sure that it's followed up upon. A driving assessment is just one appointment, so there's not always the time for the CDRS to follow up with the patient for those needs. So it's really important that case management, doctors, nurses, and the therapy team that may be seeing the patient more consistently are checking in and making sure that the patient's needs are being met. And what else can we offer them if they are struggling? If they are moving on to the on-road assessment, that is a 1.5 hour assessment. The CDRS is in the back seat of the vehicle at our facility. With the traffic environment and also their ability to follow motor vehicle law. Based on how they perform, we may recommend that they resume driving. This would then be that RMV form, the medical clearance form, is sent to the physician for completion and then goes back to the patient. And as I started to say initially, we have a process where it's a self-report state. The patient then takes that form that is essentially clearing them to resume driving, and it's up to them to send it into the medical affairs branch of the registry, letting them know, yes, I've had a brain injury, a stroke, whatever the issue may be, but I've been cleared to resume driving. Another recommendation may be lessons with a local driving school or with our vendor company if there are more specialized needs. Sometimes we recommend driving practice with a licensed driver. It could be a spouse, and this isn't often, but sometimes it's just that they need a little confidence, a little support in the vehicle because they're nervous about something. It wouldn't be any kind of specialized training. It would just really be for support. There are some unique cases where we may have to follow up with the physician before we're clearing them to drive. Does not happen often, but it could happen. And then other times people come to us with permits and they do have to follow up with the licensing authority, and they would have to take a test at the RMV to have that permit then transition to a license. And then there are times where we're recommending that somebody retire from driving based on their performance on the road. This would be a significant amount of critical errors, as well as sometimes it's coupled with a progressive disease diagnosis, maybe prior accidents. So there has to be a whole, a process of impairments that would lead up to that recommendation. And they are aware, they do sign a consent, and they are aware that we are not a licensing authority. We can't take away their license, but we do have an ethical responsibility to follow up with the RMV. So we do let the RMV know. And then the RMV does follow up with a suspension to the patient and a means to appeal if they disagree. And consideration for the team would be medications, as well as awareness that prosthetics or any kind of adaptive equipment does need to have a stipulation put on the license. So as far as a physical therapy patient who may be dealing with an advanced prosthetic patient on the right side, and they just think that they can start driving with their right prosthetic because they're really, savvy with it now. That's not really the case. You need to know that to go follow appropriate laws, they do need to be tested out at the RMV. You cannot put adaptive equipment into a leased vehicle. These are all kinds of things that, someone may not be coming to see OT or the CDRS. So it's important for the team to know if the doctor's talking to the patient and they mentioned that they're buying a car. They just need to know that down the road that if they're going to be looking in for adaptive equipment, that these are some of the things that could come up. Medications as well. And the progressive disease process, patient diagnoses, as well as referrals. And lastly, another team consideration would be for if your patient does not have occupational therapy on board, you want to make sure that you are referring to the OT. They can screen for some of these pre-driving issues and identify if they need to move on to see the CDRS. If it is someone that has obvious adaptive equipment needs, and the referral can go directly to the CDRS for a pre-driving program. So lastly, I would just like to take a little bit of time to reflect on what we've discussed. Everything that we've talked about today. We're also right now going to view a case study, and I'd like you to make a list of the impairment areas that, the top impairment areas that you're identifying based on what we've talked about today and what you already know. And we already have our pre-assigned groups. So I'll give you all a few minutes to go ahead and do that, and then we'll regroup from there. Thanks for joining me today. And if you have any questions, I'd be happy to answer those.